many reasons for dogs to have a cough or a runny nose. When those coughs are due to canine infectious respiratory disease complex, often called kennel cough, are antibiotics always necessary? A cough that comes on suddenly is characteristic for canine infectious respiratory disease complex, or CIRDC, also commonly known as kennel cough. It's a syndrome caused by a variety of highly contagious bacteria and viruses that cause infection and inflammation of the trachea and large airways. Infections with more than one agent are common. Encounters with dogs in dog parks, doggy daycare, kennels, and other social settings can put dogs at risk for developing CIRDC. All ages and breeds are susceptible. Severity of clinical signs can range from mild to severe. Most dogs have mild infections limited to the upper respiratory tract, with cough and possibly sneezing and some mild clear nasal and ocular discharge. Despite coughing, the dogs have good energy levels and normal appetites. In these cases, it is best to take a watch and wait approach instead of using antibiotics. This means monitoring clinical signs and waiting to see if a dog's immune system can fight off infection before using antibiotics. The good news is that most healthy dogs can clear CIRDC infections on their own in about 10 days. For these dogs, ensure adequate nutrition, keep them away from other dogs to avoid spread of disease, and if needed, provide anti-inflammatory medications or cough suppressants for dogs with non-productive coughs. But why not use antibiotics, just in case? Antibiotics won't treat viral components of CIRDC, and antibiotics risk doing harm. Some can cause stomach upset, diarrhea, or even rarely damage to organs like the liver. We know that they can disrupt the intestinal microbiome, the good bacteria in the gut that have beneficial effects for the whole body. So when should antibiotics be used? While a cough can persist for weeks after CIRDC infection, dogs experiencing more severe forms of illness at any time during the disease course, even within the 10-day watchful waiting period, may benefit from antibiotics. Signs of severe disease include fever, not wanting to eat, listlessness, thick opaque nasal discharge, and possibly increased respiratory rate and effort when breathing. Dogs at higher risk for severe disease include very young and very old dogs, those that are pregnant, immunocompromised, and dogs with smushed faces or underlying heart or respiratory disease. Which antibiotics should be used in severe cases? Doxycycline, even in young animals, is the first choice drug since it's effective against the usual bacterial suspects, Bordetella bronchoseptica and Mycoplasma. Dogs with evidence of pneumonia may require broader spectrum coverage with a fluoroquinolone and a penicillin or clindamycin. These dogs may require hospitalization for oxygen and fluid therapy. Aim for 7 days of antibiotic use, keeping in mind that cough and lung abnormalities on x-rays can linger well past the resolution of the bacterial infection. Cough, sniffle, or sneeze? Most dogs just need some cuddles and symptomatic care. Any concerns, a veterinarian can determine whether an antibiotic is needed. For more help with antibiotic decision-making, check out resources at www.arsi.umn.edu.